Hey everyone, my name is Taylor, and in this presentation, I'm going to discuss my perception of the professional image of a nurse and how it has evolved over the years. First, I wanted to provide a definition for what exactly a professional image was. A professional image describes the way a person conducts themselves and how they are viewed at work and in other professional settings and by the public. Essentially, it is our appearance and our reputation as a profession. Our image shapes our patients' viewpoints of our professional competency, and it gives them some insight on the quality of healthcare that we're about to provide them. It affects our abilities to develop open, caring, and trusting relationships with not only our patients, but their families and other professional constituents that we work closely with. On this slide, I decided to include several components that I felt like were important and contributed to the professional image of a nurse. They are your appearance, behavior and attitude, communication style, education, the professional setting that you work in, nursing culture over the years, and patient care practices. I broke them down further on the next two slides. So, starting with appearance, our appearance is our patient's first impression of us. We must be clean, neat, and well groomed. I believe that nurses who present themselves well kept give off an air of confidence. And if we're confident in ourselves, our patients are likely to be confident in the care that we're about to provide them as well. Initially, nursing uniforms consisted of an all white gown and a nursing cap, and we have since adopted scrubs as our professional uniform. But I think having a uniform reflects a big part of our appearance in the nursing image and in the professional environment. The next one is behavior and attitude. This refers to how one carries themselves. It's important that we are confident without coming off as arrogant. I believe that it's also important to treat people with respect. Our attitudes can have a positive or a negative impact on our productivity, so that's something to be mindful of at work. Taking initiative, addressing responsibilities, and encouraging others are all components that would reflect a professional attitude. The third bullet was communication style. Our conversation habits and language are both part of our professional image. How we speak about ourselves, others, and the work that we perform, along with our tone of voice and the words that we choose to use, are all important. It's also important to consider our nonverbal communication. So we need to be mindful of things like hand gestures, eye contact, and facial expressions. On the next slide, we break down education. Education supports better patient outcomes. We all know that the healthcare is an ever-changing environment. So if we have a strong foundation, we are able to adapt to those evolving models in healthcare, which is why we do our continuing education classes every year. Nursing started as an extension of traditional caretaking and has since evolved to universal clinical practices with options to earn associate's degrees, bachelor's degrees, and master's programs. So it's definitely has evolved over the years. Along with that, our professional setting has changed. With Florence Nightingale, they were on the battlefields, and that was our professional setting. Now the settings have grown, and we are located in hospital offices, doctor's offices, home health care services, assisted living facilities, schools, even prisons. Um, the setting started to change the more they added training into our curriculum. And with that training and that setting changed, nurses became more respected medical personnel. The next one is nurse culture. Nurses started out as noble caregivers that were predominantly female in the 20th century. Over the time, negative images did start to flood the profession that included things such as the angel of death, the battle axe, which, if you aren't familiar with, is a tyrannical, fierce matron. Um, there was lots of male nurse stigmas surrounding that profession for men. And then, of course, we've all seen the memes of the naughty nurses, which and the Halloween costumes, which I don't think that really do us a good deed of service as a profession. But on top of that, it's also kind of been highlighted sometimes in a negative way for having really long and exhausting hours. Nurses are said to be on their feet all day in departments that are short staffed. And, we're really in there doing the dirty work of it all. We're doing things that doctors don't have time to do or don't want to do, which I think over time has all kind of affected us in a negative way. And it definitely would impact new recruitment of nurses coming in. So that's something that we need to consider and maybe change. I think with COVID and other big things in the world, it has shifted us back and highlighted us as healthcare heroes with a focus on us having more education and healthcare knowledge. I believe over time we have diversified the gender norm, and our salaries have increased, which is something that wasn't there back in nursing culture back in the day. The last bullet was patient care practice. Patient care is our number one priority. So it's really important that we take the time to establish those trusting relationships with our patients, their family members, and our other healthcare workers. It's also important that we provide compassionate and respectful care, and that we advocate for our patients, because I think that by doing those things, they in turn reflect us as a discipline. And I think it only adds to our professional image. On the next slide, I decided to showcase some of those stigmas and those negative nursing images that we've seen over the years. I had an image on there to kind of display some nursing burnout, along with the angel of death, the stigmas with male nurses, the naughty nurse, and of course, the reputation we have with working too closely with our doctors. And then I like to follow it with some more positive images of nurses. I put in there, to me, that nurses are brave, they're strong, compassionate, we're selfless, we're skilled, we're competent and knowledgeable. And I think that some of these images reflect some of our best qualities. So it would be better to have those out there than the ones on the previous slide. To personalize my presentation a little bit, I did want to highlight the discrepancies in nursing images among nurses in various departments. When I graduated nursing school and I found my very first job, everybody's question was, well, which department are you working in now? And after expressing that I chose to be a circulating nurse in the operating room, you could just see from their reactions the stigma placed on that specific role, as I'm sure other roles in other departments get from time to time. But personally, I have had people make comments to me such as, oh, that's not real nursing, or that's such a cake job. And I would happily argue that it is real nursing, and we face several challenges of our own. Once we're hired, we have to go through a 6-month peri-op training program in which they educate us on things such as sterility, equipment, surgical instruments, operating room hazards, positioning, charting, and safety in the OR. We have to then pass an exam, receiving certification from our peri-op training. And then after that, our orientation is another additional 6 to 8 months with a preceptor before we're actually circulating on our own. And they do that because perioperative nursing is vastly different from the nursing styles we were taught during school, but it is an important job nonetheless. We perform assessments on our patients prior to surgery, just as nurses would in other departments. And while we do only see one patient at a time, we are still responsible for catering to surgeons, PAs, surgical assistants, surgical techs, certified nurse anesthetists, the anesthesiologists, and the medical supply vendors that are all in the operating room with us. So it does feel remarkably similar to how other nurses juggle multiple patients on the floors at one time. Most of all those people that I listed above must remain completely sterile during the procedures. So if they need more equipment or different supplies, I, as a circulating nurse, am the one running to obtain them. We are also in charge of documenting anything and everything that happens in the operating room. If there are equipment malfunctions during surgery, we are the ones to get it back up and running. So we have to have training for that as well. And God forbid our patient codes on the operating room table, we do not receive additional support from the hospital's rapid response teams that come to help. It's important that our environment stays sterile. So our code team are the people that are in the OR room with us, which sometimes can be a little intimidating given the resources that the rest of the hospital has. So they prepare us for that as well. We advocate for our patients in vulnerable situations when they're unable to speak for themselves. We take the time to communicate with families, and we work closely with both preoperative and PACU nurses, ensuring that we give detailed handoff reports and that the patients have smooth transitions to recovery. So while our job specifications are different, I feel like they're equally important and deserving of respect, especially from our fellow nurses in other departments. So I wanted to put that in there as well. In conclusion, as nurses, we have the professional power to change the image of nursing and get rid of the stereotypes that we know are untrue. It's important that we focus on our appearance, speak positively about our profession, treat people with respect, provide ethical patient care, and continue our education, along with staying informed on best practices. I feel like if we do that and we focus on that, we're only going to better our professional image. So thank you so much for watching. I hope you enjoyed.